Well, hello everyone. Good evening, good afternoon from wherever you are. We are so excited that you have decided to join us today for this incredibly important topic of infertility. Please, as I was about to say, I'm seeing you guys are already active in the chat. We love to see it. So, hello from Milwaukee, from Ohio, from Connecticut, wherever you are. We love to see where you guys are. Hello, Dallas. So I think we're going to start in just a minute. We want to allow people a chance to come in, to settle down. So in about 1 minute, we're going to go ahead and get started, but continue to say your hellos. We're so excited to have you. So we'll start at 7:05. All right. Well, it looks like we have a good amount of people to go ahead and get started. Hello from Atlanta. Love A-Town. Well, we're gonna go ahead and get started. Hello, everyone. Again, thank you so much for joining us. My name is Michaela Guerrier. I have my master's in public health, my concentration in maternal and child health. I am an advocate, I'm an educator, and I'm also a breastfeeding counselor. So I tend to work on the side of after conception, and then I work with our mommies there. But in this case, we're going to be talking about a topic that is very near and dear to our hearts in the maternal and child health community, and especially within the Black community as well. And that is infertility. So, especially for us as Black women, you know that we love to focus on Black women. We are twice as likely to experience infertility and less likely to seek or receive treatment when it comes to infertility. So, we're really going to get into the emotional aspect, the social aspect, and especially the psychological aspect of infertility today. So I just wanted to mention that during Dr. Erica's presentation, please feel free to drop your questions in the chat. I know sometimes if you wait till the end, you might forget. So go ahead and drop your questions, and then we will make sure that we have enough time to address your questions at the end. So as the presentation is going on, drop your questions and we'll address them. All right. So without any further ado, I would love to introduce Dr. Erica McKinney. She is bright, she is intelligent, she is a mentor for so many women, and she's going to educate us on the ins and outs and the psychological aspect of infertility. So welcome, Dr. Erica. We are so happy to have you and excited to get into it today.
Good
Oh, you're on mute. There you go.
evening. There, I got it. Okay, I was able to get multiple screens going. So I'm
Nice,
able to share my
perfect.
slide. All right. Okay. So good evening, everyone. My name is Dr. Erica McKinney. I'm a licensed psychologist as well as a certified international perinatal certified provider. And I have a specialty in reproductive medicine. That's really just a fancy way of saying that I specialize in working with folks throughout the reproductive process. Currently, I'm an assistant professor at College of Wisconsin. So before I get started, it's really important for me as a Black psychologist that I honor and I acknowledge the greats that came before me. So Dr. Mamie Phipps Clark, Kenneth Clark, Dr. Francis Cicely Summer, and Dr. Joseph White. And so for me as a Black psychologist, it's really important that I honor these folks because they were able to accomplish a lot of different things that paved the way for someone like me to be sitting in front of you all today having these conversations. So talking about objectives today. So the first objective is I want to describe and talk about the emotional and psychological aspect of infertility. Particularly, I want to talk about how that experience is a little different for Black women and Black birthing individuals, talking about the stigma, the systemic inequities, and cultural narratives that can impact infertility experiences. And then talk about the importance of interdisciplinary collaboration between medical and mental health providers. That's really just a fancy way of saying, why is it important for mental health providers and medical professionals to work together when they are caring for Black females, Black birthing people, or Black women who are experiencing infertility? As we continue our conversation, I want us to be mindful that Black women are not monolithic. And what that essentially means is that there are so many cultural variations within Black women, Black birthing people. And so while I'm going to be using the term Black women, Black birthing people, it's really important that we stay mindful that Black women, we're dynamic. And so even though we may share in similar ethnic or racial identities or connections, there are other factors that contribute to our dynamic abilities and lived experiences. And so it's important that we stay grounded in that today, and as always, when we're talking about infertility in Black women. All right, so a reproductive story. So I want everyone to just take a second and I want you to think about what is your reproductive story? So for most people, at some point, they started thinking about parenthood in their adolescent teenage years. They may have thought about wanting to be a parent or not being a parent. They may have started to decide how important parenthood or motherhood was or was not for them. And so, with that, when we're thinking about working with patients or individuals who have infertility, essentially what we are thinking about is what happens when the reproductive story that you have thought about, maybe prayed about, planned for, is abruptly disrupted. And this is where we start thinking about the emotional and psychological aspects of infertility. An African proverb says, You don't know where you're going until you know where you've been. And this is really important when we're thinking about infertility with Black women. So let's talk about the psychological burden of like sexuality and reproduction for Black women. So Dr. Gail Elizabeth Watts, she's a pioneering American clinical psychologist. She's also a board certified sex expert, and she's a professor. And one of the research areas that she examines is how slavery's legacy has impacted African Americans women's experience of sexuality. And in her research, what she has found is kind of these three themes, which is oftentimes Black women or Black girls had to learn how to behave one way, even if you felt another from a sexuality perspective. Two, you didn't discuss the kind of abuse you were experiencing. So when you did experience things related to your body autonomy, you were silenced, you were taught to silence, you were expected to be silent. And you had to live with a sense of dignity in spite of the abuse. So, this kind of concept of even though things aren't going how they should be, you should be grateful, you should be hopeful, you should be forward thinking. And why this is important when it comes to infertility, as a psychologist, for me, I think about how Black women and the decisions that you have to make about your sexuality during your childhood, during adolescence, and young adulthood can significantly impact how you see your body, how you experience your body, and the relationship you have with your body, and how that can be disrupted through the infertility process. Some of the things that we know Black women, Black girls often have to learn, and they learn either based off of what they were told, what they weren't told, or what they saw happening with no explanation. It's like when to become sexually active, how to express your sexuality, whether and how you had control over your reproductive abilities, abilities to have children, abilities to say, no, I don't want to have any kids, how we express that to others, and then how sex is used in our relationships. So again, when thinking about Black women, particularly in infertility, it's really important that we think about the context in which Black women have experienced reproductive freedom and been able to live inside of their bodies from a reproductive standpoint. So now I want to talk about some infertility prevalence. So what we know right now is that 1 in 8 couples have infertility concerns or trouble conceiving. Infertility is generally defined as difficulty conceiving naturally for 1 year or more. The length of time that a couple may present to a fertility clinic after trying actively naturally can be really variable. And it can be based off of their reproductive history, acceptance of infertility, their family planning goals, their access to reproductive care, medical coverage, and financial resources, and acceptance of factors contributing to infertility. So for most fertility or infertility clinics, they may be called reproductive medicine clinics. You are required to have a referral typically from a general OB/GYN provider. And so in working with the general OB/GYN provider from a female perspective, after trying to conceive for a certain period of time, they may put that referral in. Or for a male, they oftentimes will see like a urologist or a family medicine doctor or their primary care doctor. Um, so when you think about infertility, it's split into kind of two things, female factor and male factor. Female factors can be incredibly variable. One is diminished ovarian reserve. And so essentially what that means is as we get older, we lose the number of eggs that we have. As females, we're born with all of the eggs. It doesn't necessarily mean that the quality of the eggs decrease, but the number that's available to be used. Chronic health conditions can contribute to female factor, such as poorly managed diabetes or high blood pressure, endometriosis, uterine fibroids, PCOS. So those three, endometriosis, uterine fibroids, and PCOS, research is showing that Black women are disproportionately impacted by this diagnosis, that we're having more pain, more severity, more impairment, but also there's a delay in evaluation, treatment, and care. Also, if there's someone who's in a same-sex relationship, that is considered a female factor. Then there's male factor. which I won't spend a ton of time on because we want to focus on, I really want to focus on Black women. But in thinking about infertility, know that it's not always the female partner. Azospermia is essentially where there's no sperm in the semen. Chronic health conditions, genetic factors, surgeries or injuries, substance misuse or dependency all can impact a male's reproductive system and cause infertility. So, what do we know in regards to disparities and racial disparities in fertility care, particularly when it comes to Black women? We know that Black women are half as likely to seek fertility treatment services than white women, and there are several factors that contribute to those disparities, and they really speak to the systemic and stigma inequities. So, one thing that we know is that there is limited access to care due to socioeconomic factors. So even when patients have access to fertility care, Black women who seek fertility infertility evaluation and treatment often have lower rates and discontinue fertility treatment at higher rates compared to other patients. We know from a research perspective that Black women are seeking fertility treatment later. As I mentioned, there's a lot of hoops and barriers that people have to navigate before they can even get to a fertility specialist. And so for some people, they just decide not to spend the time, spend the money, spend the resources in order to have an evaluation. Mistrust in the healthcare system. Um, right now, in the health disparities research, we are learning and we continue to see that Black women are mistreated in the healthcare system across many different specialties. There's a lot of focus right now within maternal fetal health. We're seeing that Black and Brown women are having poor health outcomes during the pregnancy, after the pregnancy, during the postpartum period. Research has consistently shown that white providers oftentimes minimize the pain reports of Black women, even in emergency care, in primary care, in OB-GYN, family medicine, every specialty, you name it, it's being highlighted. We know that it's happening, and we know that it's directly impacting a patient's ability to trust their healthcare provider. And if there's no trust there, it's likely that patients will not follow through with treatment recommendations. We're also seeing that there are higher infertility rates. So when Black women are seeking fertility treatments such as IVF or IUI, they are being found to have lower success rates. And so that is also contributing to the disparity as well. And as I mentioned, given that fertility diagnoses such as endometriosis, PCOS, and uterine fibroids significantly impact one's fertility, Black women are also disproportionately impacted by those things, which is also contributing to higher infertility rates. So I want to take a second to talk about mistrust in the medical system. When we talk about reproductive trauma, we talk about trauma in Black women. Where I always go back to is it's very easy for us to think about things that have happened in the past as history without acknowledging that they are still ever much present. So particularly from a reproductive lens, I automatically think back to like the Tuskegee syphilis study. A lot of people will talk about it in a framework of, oh, that was in the 70s that happened. That was so long ago. But what I always like to recenter people to consider is that the whistleblower of the study, he died last year at the age of 86. And there are still individuals who are living who were either a part of that study, they have fathers who were part of that study, uncles who were part of that study, cousins who were part of that study. And so it's really important that when we think about the medical mistrust when it comes from a reproductive perspective, that we consider how these types of things are still very much um, a thing that's talked about in the Black community, and we really have to acknowledge it for what it is and the impact that it has had and how it impacts the landscape of reproductive medicine for Black women or Black families in general. So now I want to talk a little bit about different types of treatment for infertility. Um, for infertility, there may be surgeries that could be offered. Female infertility, such as removal of uterine fibroids, which is known as like a myomectomy. It can be incredibly painful. Oftentimes, you have to be off work for an extended period of time, meaning that Black women will either need to take time off work. have plans for other children that they may have that need to be cared for. It's not like you can just have this surgery and then, you don't always are always able to bounce right back. There can be laparoscopies where endometrium tissue is removed. That can be very painful. Also, if someone has had like a tubal ligation, in which their tubes are or if their tubes are blocked, they may go through some type of procedure again to address that. For male factor, there are other surgeries like something called a microtessie, where they literally take a needle and they go into the penis and try to aspirate the sperm. A lot of these procedures may not be covered under insurance, or if they are covered, patients are still left with a significant deductible. And all of these things are typically recommended to optimize what they would call success in fertility treatment. So providers will recommend that these things happen prior to trying to conceive through IUI or IVF. And then also different medications, hormonal medications to help with balancing out someone's endocrine system, or even like optimizing their physical health. So if someone has diabetes, they want to optimize their health, get their blood sugar within a normal range because research has shown that those factors can contribute to infertility. So now I wanted to take a second to just talk about IUI and IVF. So IUI is essentially when sperm is placed into a woman's uterus with a catheter. Sperm is placed into the catheter. This is done when she's ovulating in hopes that she will achieve pregnancy. And then IVF, we hear a lot more about that now. It's a very invasive um, procedure, lots of medications, lots of doctor's appointments, lots of monitoring, lots of lab work to really prepare the female body to have the eggs retrieved. IVF is very expensive, and the variability of health insurance coverage for IVF is really dependent. The cost of IVF can go up to $20,000. And so this is not even including initially establishing with the OB/GYN doctor, initially getting in to see a reproductive medicine specialist. This is just for that one IVF cycle to retrieve those eggs. So when we start thinking about what this means for Black women and how it contributes to the disparities in infertility, I want to share some numbers with you. The US Census Bureau found in 2022 that Black women working full time year round had a median annual earnings of approximately $49,000. So I just mentioned that IVF is like $20,000 a cycle. It could be more. So we're potentially looking at someone using half of their income, yearly income, for an IVF cycle where there's no guarantee that eggs will be retrieved or embryos will be created. When we start thinking about Black families, in 2022, the Census Bureau found that the median household income for Black families was $56,000 in comparison to $80,000. I'm sorry, $89,000 for white non-Hispanics, and then $112,000 for Asian households. So even when we're looking at single households or dual households, we're thinking that someone who chooses to do IVF is significantly going to be stretching their resources at an attempt to achieve pregnancy, and there's no guarantee that they will be successful. So now I just want to talk a little bit about third-party reproduction. So for someone who's experiencing infertility, as I mentioned, they'll go through an evaluation. They may have surgeries, they may have medications, they may attempt through IVF, they may attempt through IUI. If that's not successful, they may start to consider using donor sperm, donor egg, or embryo donation. Again, this is an incredibly costly process. And not only is it financially taxing, but there is a huge emotional component. So, as I mentioned, when we started talking, like we all have our reproductive stories. For most people, difficulty conceiving is not a part of that story. Having to conceive through IUI is not a part of that story. Having to conceive through IVF is not a part of that story. But also, a part of that story oftentimes is not potentially having a child that they are genetically connected to. And this is where you see a lot of grief and emotional turmoil when patients or individuals get to this point in their reproductive journey. They're grieving about the inability to have a child they're genetically connected to or connected to both partners. They may be experiencing grief related to how do they share this information with family and friends. Um, they may be toying with or struggling with this idea if they have children that they've naturally conceived with their current partner or previous partners. What will it mean for their children not to be genetically connected or completely genetically connected to their siblings? Also, what type of support do they have in regards to the decision to conceiving? A common thing that I often hear my patients want to talk to me about, Black women questioning their religious beliefs and asking me, like, Dr. McKinney, if I do IVF or I use donor sperm or donor egg or embryo donation, am I playing God? So there can also be this spiritual religious component where things are starting to conflict. When we start talking about the emotional aspect of infertility and disparities, we also know that this is true amongst donors. So this was an article put up by the New York Times in 2022, and it reads, America has a Black sperm donor shortage. Black women are paying the price. So essentially what this looks like in a disparities aspect is that I am seeing individual couples, Black couples, who may need to use donor sperm or donor egg or donor embryos, and there are no Black donors available. And so not only are they grieving that their reproductive story does not look how they thought it would, they're also beginning to grieve that they may either have to choose alternative pathways to parenthood, such as adoption or choosing not to have children, or potentially raising a biracial child. And so these are these considerations that Black women are experiencing. Once you get to a point in your fertility journey where the doctors are saying that you have to conceive using donor sperm or donor egg, if you choose not to proceed, it's kind of like you automatically have to start shifting. Okay, how important is parenthood for me? Do I want to raise a biracial child? Do I want to adopt, or do I just want to stop altogether? So here's just some numbers I was able to pull. This was posted by the Washington Post. So you can see the disparities, white donors being 391 in comparison to Black donors being 12. In addition to conceiving through third party reproduction, there is also this other aspect of gestational carrying, formerly known as surrogacy. This option is available to Black women, but it is in a very expensive process. So, this is Candy. She's a singer, songwriter, Grammy, everything. She's on Housewives of Atlanta. She's a business owner. And she was actually very vocal about her decision to conceive with a gestational carrier. She had uterine fibroids, had undergone many surgeries, conceived through IVF. She had one embryo remaining, but given her fibroids, she really wanted to optimize the opportunity to achieve a pregnancy. So she chose to proceed with the gestational carrier. So this her carrier, that's Candy, and then Todd, her husband. And if you followed Housewives of Atlanta as it was happening, it just brought me so much joy to see this, to see that there are Black women who are choosing alternative pathways to motherhood. Um, One of the significant barriers with this is that it's incredibly expensive, ranging between 90 to 100 and $150,000 on average. Insurance does not cover a gestational carrier. And this cost includes the compensation, agency fees if you go through an agency, medical expenses, legal fees, and miscellaneous costs. So again, 90,000 to 150,000. And again, I want to bring us back to the average salary from 2022 for Black women was $9,000. So the affordability aspect. Choosing to proceed with the gestational carrier is incredibly emotional. Um, as I mentioned, not only do you have to have the financial resources for this, but you're also grieving the loss of experiencing a pregnancy. You're grieving the loss of carrying a pregnancy. You're having to emotionally adjust to the expectations for personhood, for motherhood, for parenthood. For a lot of women, they think about their baby shower and taking baby shower pictures, or doing gender reveal pictures. And so having to think about, are those still things that you want to do? If so, in what way do you honor your motherhood when you're not carrying that pregnancy? And then also, who can you talk to about this? Um, Infertility is an incredibly isolating experience. And when you start adding on the nuances of a gestational carrier or an egg donor or a sperm donor, you're really looking at intense emotions that oftentimes patients or individuals are sitting with, and they don't have a lot of support as they're navigating it. Even if they have a supportive partner, because their partner is likely having their own emotional reactions as well. So the psychological impact of infertility, um, roller coaster of emotions, feelings of isolation, feeling inadequate, right? I've had a lot of my patients say, like, Dr. McKinney, my body has failed me. My body is not doing what it was designed to do. And again, this brings me back to when we think about the history of Black women and sexuality in our bodies, right? The hypersexuality of Black women, how Black women were perceived during slavery, that we were considered baby making machines, right? This was something that we naturally were able to do it quickly, do it well. And so, what happens when you can't? What does that mean for your Black identity? What does that mean for your identity as a Black woman? Self blame and guilt. As I mentioned, some infertility can be caused due to lifestyle changes or management. So, excessive alcohol use or drug use, not optimizing your health, your physical wellness. And so, sometimes people will start to blame themselves as they reflect on decisions that they've made over time. And then the loss of control. You can't control your fertility journey. You can do everything that you can that's available to you, but ultimately there is no control. And so that's where that anxiety piece comes in. One thing that I really wanted to talk about today, as it speaks to the infertility aspect in Black women and not being alone, is this concept of disenfranchised grief and loss. This is an incredibly painful experience for a lot of women. And what makes it even more painful is this concept of disfranchised grief and loss. And what this really means is that grieving infertility is not really tangible. When you lose a parent or a dog or a relationship ends, or you lose a job, right? You have a tangible object that you can point to, that you can talk to. You may have rituals that you can do to honor that grief, right? But with infertility, it's really difficult to do that. And it can significantly contribute to these feelings of isolation. The invisible loss of infertility can leave people alone with their feelings many times. They're alone because the only people who may know what has happened are the medical doctors and their partner. And so there's not really a lot of space to share. When someone is pregnant early in pregnancy, that woman may feel every twingle, every body ache, every sense of nausea, and that pregnancy is happening and that baby is growing and it's real. But when there's a miscarriage, there's no tangible evidence. And that grief can be misunderstood or recognized. So commonly, I have patients, particularly my Black women, who may experience early pregnancy loss, like 5 or 6 weeks. And they'll say, like, Dr. McKinney, like, people really don't understand. Like, they'll say, like, oh, you were so early into your pregnancy. And for people who've experienced pregnancy loss, it doesn't matter if you were 5 weeks in or you were 20 weeks in, the thing that you have been planning and preparing for, you no longer have it. Fertility treatment can also evoke similar feelings. Being at home, having to inject yourself with hormones in the privacy of your home can be emotionally taxing, but then emotionally invisible. When you talk to individuals who have gone through IVF, they'll talk about waiting for their medications to be delivered and having to get them home and get them organized and set up timers and really organizing their life around trying to conceive. Um, Also, if there's not a positive pregnancy result, acknowledging that their cycle has came, that is a loss. I'll never forget, I had a patient say to me, said, Dr. McKinney, if I needed to attend funeral, like my my time would be granted off for work. My boss would say, "Sure, no problem, not an issue." She said, "But if I told him my period came again this month and I'm not pregnant and I'm grieving," she said, "my boss would probably look at me like I'm crazy." And I was like, wow, that is disenfranchised grief and loss. And so, again, I always also go back to thinking about Black women, their experiences with their bodies, what we've been taught, what we have learned. Essentially, this disenfranchised grief and loss further kind of facilitates this concept of even when something isn't going well and it doesn't feel good, act like you should. Silence, even when something's happening and you know it's not right, don't talk about it. And so it's really important when we think about Black women and infertility, we are so, so mindful in holding space for this disenfranchised grief and loss. So I want to offer kind of some solutions because I know that there are people from different disciplines here and different experiences. And so interdisciplinary collaboration across research, across all health disorders, has found to optimize or really help improve one's health. This is particularly needed when it comes to caring for Black women who are experiencing infertility. As medical providers, it is important that the patient is a part of the team, that they're engaged in shared decision making, they're able to ask questions, they are brought in, and things are explained to them in a way that they understand. um, Colleague collaboration. So my role is a little unique because I'm physically located in an infertility clinic, and that's not always the case. So if you're a mental health provider, and you are really passionate about this topic and you want to get involved, it's really important to start developing those relationships with the medical clinics. Reach out to the head nurse or the charge nurse or the medical director and start talking about what pathways for referrals can be put in place. I can tell you there has not been one patient that I've seen as I've been in women's health who has said, I'm really enjoying fertility treatment and evaluation. I don't need to see a psychologist or I don't need to see a mental health professional. It is needed. And it has shown to not only improve mental health symptoms, but just overall well-being for the patient and the partner. Caring for Black women requires lots of hands on deck. There's lots of advocacy organizations that are doing very, very meaningful work. They have resources, they have individuals who can help write grants for patients. And so, if you are working in this area, it's really important to kind of get out of that lens of, well, we can only help them while they are in our clinic. Having a social worker embedded or working with social workers, working with advocacy agencies, and I'll share a few in my slides at the end, can really help address these concerns that Black women are experiencing in infertility. It is so, so important that fertility centers are providing and affirming and culturally responsive care. And it first starts with us recognizing that we all have our own individual values and beliefs assumptions and worldviews. Arguably, I say that fertility and pregnancy is probably one of the most culturally nuanced medical conditions. And so it's really important that if you are working in this area, that you are very aware of what your biases and your beliefs are when it comes to culture and religion and kinship and family views, beliefs about health and wellness, and gender roles, because that will directly impact your care that you are providing patients. It's important that you are working towards achieving cultural awareness. As I mentioned, remembering that Black women are monolithic. So you may see 5 Black patients in one day. It's important to remember that they are all different. They may share similar racial or ethnic backgrounds. They may even share some similar lived experiences, but really being mindful that you're treating each individual patient as their own. um, Trauma informed and anti-racist practices. So this means being prepared and acknowledging that clients or patients may want to discuss their reproductive trauma, their medical mistrust, and how this is guiding their decisions as it relates to fertility care. This may look like spending more time with the patient answering questions. It may look like sending extra messages to the patients for reassurance. It may look like being comfortable with patients bringing in family support systems to also be a part of the team, to ask questions, to have an advocate, to really ensure that they are getting good care. The last thing is representation among providers and support spaces are needed. As Michaela mentioned, I mentor lots of Black women in the psychology and medicine field. I really believe in lending my hand back as I'm climbing because I recognize I can't do it all. We need more people in spaces. This is also a call for anyone who is on here that may not identify as a Black woman. If you hold privileges that allow you to be in spaces where you can start naming anti-racist practices and putting things in place, putting programs in place, putting policies in place, being involved in hiring diverse medical providers and mental health providers, I really encourage you to do that because that's going to help us move towards addressing these unique experiences that Black women are experiencing as they're navigating infertility. And then for my Black women who are here because they have experienced infertility, I want to share a couple of things with you. But I want to say this, I was very intentional about placing this last um, and not before the recommendations for medical providers and mental health providers. And the reason being is that I recognize that Black women, we will have a difficult time doing the things that we need to do if systems and policies are not in place for us to optimize our well-being. And so some things that I can leave you with is seek fertility care sooner. I know it's scary. I know it's expensive, but if you have the financial means, get your soror, get your cousin, your sister, your friend, get somebody to come with you and find out what is available to you. We have to continue to optimize our physical health. Black women, we are disproportionately impacted by every medical condition that you can think of. And a lot of those conditions directly impact your ability to achieve a pregnancy. Research insurance coverage and payment programs. I know this is time consuming, but it can be worth your while. I cannot tell you how many Black women I've worked with who said, I don't have coverage. I sit them down with our financial counselor, and turns out they do have coverage. If it's something that's important to you, ask your clinic that you're working with. Is there someone that you can talk to, a social worker, a financial counselor, someone that can help you navigate your insurance? Psychological support. Go talk to somebody. There are lots of mental health providers who are specializing in reproductive medicine, who are specializing in fertility. It is a stressful process, and research continuously shows that meeting with a mental health provider who is trained in this area can help with your coping. It will not change what is happening, but it can definitely change what you're feeling and how you're navigating it. And then using complementary approaches, religious practices, spiritual practices, yoga, meditation, kickboxing, whatever it is that brings you your calm, continue to do those things. Infertility treatment and evaluation can take up so much time, so much space. And so it's really important that you are prioritizing finding joy in your life. And here is some resources. By no means is this exhaustive, but these are some things that I just put together that I wanted to share with you all. Conquering Infertility and Stolen Women is a book, two books. American Society for Reproductive Medicine. That is the medicine society that provides guidance and guidelines and recommendations for individuals considering conceiving through IUI, IVF, third-party reproduction, so donor sperm, donor egg, embryo donation, gestational carrier, IPPE. If you are a medical provider and you're interested in infertility and perinatal, they offer a certification program. I am a certified provider that will prepare you to work with this population. Therapy for Black Girls, also IPPE, has directories for mental health providers who specialize in these areas. Resolve is the National Infertility Association for the United States. Lots of amazing resources, including peer support groups. And then the Broken Brown Egg is a fertility advocacy organization that was founded by a Black woman who was experiencing infertility herself. And so that is all I have. Here's my contact information. I am going to stop sharing my screen so that we can hop into questions and discussions.
I was about to talk and it was still on mute. Wow. Oh my goodness. Thank you so much, Dr. Erica. That was very comprehensive and incredibly said. Listen, I don't know about you ladies, but I was taking notes. I wasn't playing around. You can't really see it, but I was taking notes. And it really does affect women all, I guess, across the age range. I mean, I'll share a little bit about myself. I'm 28, I'm still single, don't have kids yet. So, of course, and you have, in our culture, the aunties, the TTs, they're
Mm-hmm.
always asking, when you gonna have kids?
Hmm.
And you might accidentally trigger somebody,
Yes,
with a question or a conversation that really meant well,
yes.
but you really don't know what someone is going through or that those trials and tribulations someone is experiencing. Um,
Absolutely. I always say stay out of people's uteruses. Those are not
okay,
conversations
hello.
be having. If someone wants to talk about their reproductive life, they will
Yeah,
bring it up to you. If they don't bring it up to you, they don't want to talk about it. If they don't
you
want to talk
got to
about
stay
it,
out
don't
of it.
ask about it. Lay it, stay out of it.
Yes, I absolutely agree. For anybody my age going through the questions from the aunties, we thank you.
Yep.
So we do have a couple of questions in the
Sure.
chat.
Yeah.
Um, Diani, I hope I didn't mispronounce your name, but she was asking all of the questions, so I'm really excited. The first question I do see here, she asks, does the data about infertility focus on the Black community or in general?
Yeah, so both and so what we're seeing is that Black people, so I'm going to use that to include genders and how people identify, is that when we are included in the research studies, we're such a small sample size, it's really hard to what we would call from a research perspective, make a generalization. So, for example, if there's a research study that had 100 couples and only three of those couples were Black, even if what those three Black couples said were significant, like if they were completely different than what the white couples said, it's really hard to say, well, based off of those three couples' experiences, that applies to all Black people.
Mm,
And
wow.
so that's where the health disparities research comes in, where there's now being a shift to what can we do to learn more about Black people who are experiencing infertility. But that
Mm,
poses an issue because in order to learn more about Black people who are experiencing infertility, we have to be able to find them, which means they have to be getting care, which means they have to be established in a fertility clinic so that we
yeah.
can get them into these research studies.
Mm, excellent, excellent. Diani had another question. I guess it was when we were talking about sperm donation. Have you seen cases in which a sperm donor has a gene that does make them ineligible to donate their sperm within the Black community? That is very interesting.
Yeah. So
Any
I have,
thoughts?
yeah, so I have not seen that. But what I have seen, so a little bit about being a sperm donor. So there are lots of donor banks throughout the country, and they typically have their own set of requirements in order for someone to qualify as a sperm donor. They do a comprehensive psychological evaluation. They also do medical testing. They do genetic testing as well. And so when someone is looking to purchase donor sperm, whether they are Black or white or Hispanic, what they should be advised to do is that family should do their own genetic screening prior to selecting a donor to ensure that they're not selecting a donor that is a carrier for the same gene that they have. Because for
Right.
some medical conditions, if you have two parents who are carrying it, the child likely will have it. And then there
Yeah.
also are some genetic disorders that on like one parent carrying it can increase the likelihood of that child having it. So have I seen it
Mm.
specific to not being able to to donate to the Black community? No, but generally speaking, you can be incompatible with a donor based off of your genetic makeup and their genetic makeup.
Okay. So I guess that's when you would go and consult, I don't remember the word, but
Genetic counselors. Yeah,
yes, to
yeah,
consult a genetic counselor to make sure you already know what you would be compatible with or not compatible with. So that
absolutely.
makes sense. Awesome. All right, I'm scrolling through. Next question. Are there cultural awareness trainings for non-Black maternal health professionals that teach them about the cultural groups associated with the Black community? So, i.e., African, Caribbean, etc.
Yeah, that's a really good question.
It
So,
is.
coming to mind, I can't think of anything particularly. I will say that if you are interested in reading scholarly materials about it. There are two psychologists, they're brothers. Their names are Sue and Sue. Their last names are Sue and Sue.
Mhm.
And so if you go to like PubMed or Google and put in Sue and Sue and put in multicultural counseling or yeah, multicultural counseling and multicultural psychology, you will have resources. I'm just looking up at one of my books by them, Counseling the Diverse, or was this Counseling the Culturally Diverse Theory and Practice? That book, oh, when I got it was on the sixth edition. I think we're probably around 9 or 10 now, but they do have some sections on there that break down kind of the African diaspora.
Okay, nice. Next question. Have you seen cases in which a sperm donor has a gene? Oh, did I already do that?
Oh
I
yeah,
think that was a repeat question.
yeah.
Oh, my bad. We already answered that one. Okay, I see people were kind of mentioning they were trying to take notes down too. Me too. Jamisha says that was amazing information. She took a lot from that. Okay, next question from Jamisha. Are there a different subset of challenges that one may face if they were able to conceive one child naturally without barriers, but are now faced with fertility challenges?
Absolutely. So one, kind of thinking back to the reproductive story, right? So if
Mhm.
generally speaking, if someone naturally conceives once, they oftentimes don't anticipate difficulty conceiving the next time that they try to conceive.
Yeah,
So there's a level of frustration. There's a level of self-blame. I see that a lot, self-blame and
yeah.
guilt. So if someone potentially, like if they gained a significant amount of weight during pregnancy, or they had medical complications during their pregnancy, they had gestational diabetes or something like that. And then once they try to achieve pregnancy again, there's not only this grief around having to do IUI or IVF or potentially using other genetic materials, but there's
Mhm.
just this overall frustration around why is this happening now?
Yeah.
Or why was I able to conceive naturally with fibroids the first time, but why am I not able to conceive now with fibroids?
Yeah.
This also can be incredibly frustrating from a financial standpoint. So when, it was just you and your partner, you may have had more financial resources to put towards achieving a pregnancy. But now that
Yeah.
you have a child involved, right, your finances likely have changed. And so now you may have to really be considering at what point do we say it's enough?
Yeah. Yeah. And it's very difficult too. I guess the self-blame is something that really sets in. And now you're kind of questioning, okay, what is it that I did the last time that worked that's not working this time? So a lot of women can kind of spiral in that sense. So yeah, great question, Jamisha. We do have a little bit of time, so I'm just gonna ask a question just as you were talking. So I know just from a personal aspect, my mom, she did have some infertility
Sure.
struggles.
Yeah.
But hey, I'm here.
Yeah.
So I'm
But glad
wondering,
you're here.
yes. So I am wondering, do you see any aspects of this being a genetic factor? So if my mom, as an example, if my mom struggled with infertility or just difficulty getting pregnant, is that something that would have either passed down to a daughter or to a child? What's your, I guess, take or research on that?
Yeah, absolutely. So some of these reproductive or infertility diagnoses can have a genetic connection. Um, Really interesting, a fact about fibroids in Black women. I believe it's by the age of 50, 80% of Black women will have had a fibroid.
Yep. Yeah.
So if you take 10 Black women, 8 of us will have fibroids by the time we're in our
Wow.
50s. Um,
Wow.
and so, I think there is a lot of research being done to see if there are genetic markers like PCOS, which is considered like an endocrine disorder. So, right, it impacts your hormones.
Yeah.
And so you will see, like, interestingly, you will see a family where everyone achieves pregnancy easily and there's one person who has had a hard time. And then I've
Yeah.
also worked with patients where they've had miscarriages, their mom had miscarriages, their grandma had miscarriages, great grandma has stillbirths, and there seems to be like this family history as
Yeah.
it relates to difficulties conceiving. What I think is really important for us all to remember as Black women, or if we are caring for Black women, is to encourage us or our patients to ask their moms, their aunts, what's the family history when
Yes.
it
Yeah.
comes to conceiving, because that information can be incredibly helpful
Yeah.
for the medical team as they're thinking about um, treatment recommendations. It's not
Right.
uncommon for me in my practice to see three sisters who are all doing IVF,
Yeah.
but then they don't tell each other. And I'm like, if it's happening to three people and you all have the same parents, you're in the same
Yeah.
family, this is something that should, I mean, not tell it to the world, right? But like, there should be some conversations with your nieces and nephews that, like, Auntie had a hard time. Be mindful of when you start to try. Um,
Right.
if you know that that's your history, that can inform how long a doctor will recommend you try to conceive before being referred to a fertility specialist. So
Yeah.
all of that information is important data that the medical team would need to help with figuring out what would be your next best options.
Right, absolutely. And it goes back to having those conversations and opening up, it's very vulnerable. I remember
Yeah,
what my mom told me. It wasn't an easy conversation, especially
yeah,
being an only child,
sure.
bugging my mom, I want a sister. So
Yeah,
when she finally had that conversation with me, it opened up a
yeah,
little feeling of guilt, like, oh, mom, I'm so sorry.
yeah,
But also, now there's awareness. So
yes,
now when it's my turn, I know what to do, or I have that awareness of the conversations I now have to have with my medical provider.
yeah.
And then
And
also, Yeah,
Open
just
equally, so like being able to talk to your partner, um,
yes. Yeah.
whoever you choose to procreate with, right? Like
Yeah.
those may be conversations you want to have in the dating period, right? Not everyone
Yes.
is in agreement with conceiving with IVF. Not
Yeah.
everyone is in agreement with considering other pathways to parenthood. So these are not only important conversations for you to have reproductive autonomy, but when you think about what your wants and desires are when it comes to motherhood, that you're starting to have those conversations so that you have that control. Some
Absolutely. Some could, right.
some of it.
And Diani said it perfectly. Silence about infertility issues among family members goes back to being taught to be silent. So, on that note, I'm so glad that we were able to have this conversation. Dr. Erica, thank you so much.
Yeah,
I feel like everybody on this call or on this chat learned at least one thing, and we
yeah.
took our notes, so we'll be able to review as well.
Absolutely. And I consider you all family. Please reach out.
Yes.
My email, LinkedIn, if you have questions, if you want to know what did I say in that certain slide again. We are a community. I'm dedicated to this community and happy to be a support to everyone who's here today.
Yes, absolutely.
All
Thank
righty.
you so much. We
Good.
couldn't go over everything, but we will
Yes.
definitely, we might have a part two because this was incredible.
Yeah, I would
So
love to
thank
be a part
you.
two. All righty.
Absolutely.
Okay.
Have a great evening,
Thank
everyone. Thank